Welcome, everyone, to Diversified, where our mission is to have you live in a life filled with wealth, health, and happiness. Today, we have a very special guest, Stephen Carroll. Stephen is a Medicare specialist at Savoy and has a great deal of knowledge and experience in the industry, and especially the insurance industry as it pertains to Medicare. And he's been a good friend of Diversified for years now. How you doing today, Stephen?
I'm doing fine. How are you doing, Andrew?
I'm doing great. Thanks for joining us. So let's get right out of the gates. The exciting topic of Medicare, since this is really your area of expertise, and I've been like I said, a friend and helpful to many of our clients, one of our key resources. Can you explain to those people watching? There's a lot of misnomers. What is Medicare at its highest and most basic form, and what do they know about it?
Well, Medicare, what I tell my clients is that Medicare is pretty much just basic insurance. That's just pretty much what it is, at its core. You have your When you apply for Medicare, you have your Part A benefit, which is your hospital coverage. You have your Part B benefit, which is your medical. That's what you're receiving from the federal government when you do apply for Medicare. Now,
Is there a cost to A and B?
well, it depends. So most Americans will receive Part A at no cost to them as long as they are Medicare eligible. So if you're eligible for Social Security, you will receive your Medicare Part A at no charge for yourself. Now, Part B, that's going to be charged to you based on a sliding scale based on your income from 2 years prior. Um, so there is a starting amount that they're going to charge you, and then if you are someone who makes a higher income, then you may pay more for your Part B benefit.
Right, right. Okay. And so A and B give you hospitalization and medical insurance. And then there's other forms, right? There's the donut holes and all that stuff, right? What
Yes,
what's
there is.
the Give us the 60-second breakdown of the rest, the ABCs as they call it of Medicare.
Okay, so you have your Medicare Part C, which is Medicare Advantage. Now, Medicare Advantage, it's going to mimic what we're used to having through our private insurance or through maybe your job insurance. It's usually going to be either an HMO or a PPO plan. It's an all-in-one plan, and there it does offer additional benefits that Medicare doesn't offer. And also, depending on where you live, you may also receive an offer or a benefit package for as low as a $0 cost. People do love that.
Right.
You also have what we call Medicare supplemental insurance or Medigap. It's all the same thing. That's a secondary coverage. It's going to it's going to cover your bills for you. It's going to cover your bills after Medicare pays. So Medicare pays 80%. The other 20% could be covered by a supplemental insurance where you pay either very little, depending on the package that you purchase, or you pay nothing. Also, if you do purchase a supplemental insurance, we're going to also look at a Part D plan. Part D is in David, which
Okay.
is for your prescription drugs as well. Because Medicare does not pay for your medications per se, so we're going to look for that benefit for you as well.
Okay. And what's the I know everyone has their preference. What's the most common combination that people get? So A and B everyone gets. And
Mhm.
then in your experience, if someone wants decent coverage and protection, what are you generally recommending?
Well, for the clientele that I deal with, it's usually going to be a supplemental insurance and a drug plan.
Okay. So yeah, you'll add those two on top of the A and B.
Mm-hmm. Yes, sir.
Okay. And I know there's a critical component here that is worth talking about. So your Medicare eligible at age 65, right? Let's
Correct.
say I'm still working and I have my work insurance that they're paying for. What is the roadmap there? Because I know there's some things you don't want to screw up or it can really hurt you long term.
Definitely. That's a question that I tend to answer a lot as well. So if you are working for an employer and you are aging into Medicare, my first question is going to be the size of your employer or the size of the group. So based on group size is going to depend on whether Medicare is going to be primary or secondary coverage for you. So a large group would be considered 20 or more lives.
Okay.
If it's 20 or more lives, that means your group coverage will be primary coverage.
Okay.
So my next question is, are you contributing to an HSA as well? If you are contributing to an HSA and you're working for a large group coverage and you want to continue to contribute to the HSA, I would say do not apply for Medicare as of right now. The reason why, because there can be some type of tax liability, and you want to talk to your accountant about that as well to get the
Okay.
specifics. Now, if you are working for a small group, less than 20 employees, well, at this point, Medicare is going to be primary coverage. If Medicare is primary coverage, you must at least get Medicare Part A and Part B. And then we want to discuss your options.
Okay.
You want to see if you want to keep your group coverage as secondary coverage or not, if it's going to be cost effective for you, or whether you want to get either a supplemental insurance or a Medicare Advantage at that
Go
point.
on through the system. Because if you do, what happens if you miss the window, don't sign up by the time you're 65? There's some pretty big penalties, right?
Correct. You would receive a penalty charge if you do miss your window for your Part B of Medicare. You can also receive a penalty charge if you were to miss your window for your drug plan as well. So we want to make sure that we do make these decisions in the time frame that's given to you. Now, when you're first eligible for Medicare, you actually have a total of 7 months to make your choice. 3 months before your birthday, the month of your birthday, and 3 months after. We would generally say that 6 months before you turn 65, you want to start thinking about it.
I was just gonna ask, when should you start? When should people start calling you? 6 months prior.
Yeah, give us a call 6 months prior. We'll start looking into it for you. That way, if you're going to apply for Medicare, when that first 3 months comes about, you'll know what you want already, and you can go ahead and apply for your Medicare Part A and Part B, and then we can get everything all together for you way before you turn 65. So when you turn 65, it's all set up for you. You have nothing to worry about.
Right. That's great. That's great. Okay. And give me the biggest misconception people have with Medicare in general.
Misconception? Well, let me see. Um, what I've noticed is I can't say misconception, just not understanding Medicare in a whole. A lot of our clients do not understand that when you're working for an employer, you're getting a group benefit. So as a group benefit, there are certain protections that you're receiving through your job. Also, there are additional benefits they have negotiated for you. Whereas through Medicare, it's on an individual basis, it's an individual insurance. So you're not getting those extra benefits that you were receiving before. And so they tend to compare, apples to oranges, kind of.
Okay.
So the
Right.
biggest thing for me is making them understand, well, you're no longer a part of this large group any longer. You're now individual. And so I'm going to find the best for you based on your current situation and also what you're looking for and what's the best for you, period.
And it's not, and recognizing it's not what you're used to.
It's not.
Be changed.
It definitely is not.
That makes sense. Okay. Stefan, give us your one final big tip or advice you want people to remember when it comes to the Medicare process, Medicare, choosing Medicare in general, that you think it's important that our listeners who are generally either themselves or their parents are approaching this age and need this type of service that you guys provide.
Well, definitely, I would not say do this on your own. I've seen a lot of people make mistakes by just trying to do it on their own. Please do not ignore the paperwork that you're receiving from Social Security. It is very important. There's a lot of important information that is there. If you do not know, just ask. You can either call me, or call someone like me, someone who looks at this every day and can provide the advice for you. So that way you can make the best decision for yourself. This is the most important decision you're going to make. That's going to affect the rest of your life. This is your golden years.
Right.
So you want your golden years to be just that, golden.
Right. And get it right. And the thing I would say on top of that, just working with you for years now,
Mhm.
is there's no negative to using a professional service that with an impressive team such that you run there, because you have to buy it anyways. There's no extra commission that you get by going through you versus through AARP. It's
Correct.
pretty standardized. The service that you guys bring that I've appreciated with our clients is educating and informing and holding their hand through this process. So it's basically becomes a free resource to get
Mhm.
it right. To your point, the golden years,
And I try to make it as easy as possible.
which is
That's the best that I could do for you, is to take the worry away. You
right,
know, I speak in a way that it makes it very easy to understand.
right.
And like you said, I hold your hand throughout the whole process. And I'm also here to answer questions after the fact. I'm not just here to at the beginning. I'm not here in the middle. I'm here at the end as well. If you have a problem, you can call me as well.
Yep. And we've experienced that and appreciate it through the years very much. So awesome, Stefan. Do me a favor. Tell everyone where they can get in touch, how they can get in touch with you. Of course, we'll share it below, but give a quick plug there and anything else about your guys' services worth sharing. And then I will do my big sign off. And thank you very much for joining us.
Thank you. Okay, well, in order to get in touch with me or someone in my team, you can give us a call. Our phone number is area code 833-899-6200. You can also look us up online at savoyassociates.com. We did talk about Medicare today. However, we also do handle insurance for people who are under 65. You're looking for individual or family coverage. We actually
Great.
handle that as well through the ACA as well. And also, Savoy is a general agency, so we do offer other services as well. You
Yep.
can also reach Savoy at savoyassociates.com.
Yeah, which is great. And again, not only will we share it below, but you can also reach out to myself or any of our financial planners here at Diversified, and we'll put you in touch with you and your team, Stefan. So thank you again for donating your valuable time and resources and expertise to us and all our listeners. I really appreciate it, my friend. Of course, anyone watching this that appreciates it, feel free to share it with anyone they know that could benefit. As always, I'm Andrew Rosen, President of Diversified. Stay wealthy, stay healthy, and stay happy, everyone. Take care.